Welcome to Misericordia, and thank you for coming and joining us for our conversation today about the crisis in opioid abuse. I'm Lee Morcano. If you don't know me, I'm the Dean of Health Sciences and Education.
This is a pressing challenge. There is no partisan divide, no philosophical standoff, no socioeconomic distinctions, no family, no community, and no region is immune. The victims are easily well-to-do and involved, just as they may be poor or alienated. They could be the teen who lived down the street, a young person that I know in my own community who passed away of an overdose just this past weekend. When you think about it, the athlete battling an injury, the worker who's trying to put their life together. So a crisis of this dimension does not suddenly or simply materialize. There are a lot of root causes. What makes this one tougher than the typical war on drugs is that this isn't solely a matter of bad guys or illegal activities. So we at the state level, and as I look at my friend and colleague, Representative Bobak, we've had to adjust our thinking and taking it away from being mainly focused on criminal justice measures to working concertedly on education, prevention, awareness, and treatment.
What I'm here to talk about today is something that I've never in my career seen anything quite like it. When I came to Harrisburg as the Secretary of Health and started to delve into this issue, I have to tell you I was shocked. I had never seen anything like it before. We're losing 10 people a day in Pennsylvania, 10 people a day. It has surpassed car accidents. It has surpassed all accidental death. We're losing children. We're losing a generation. Because I think it's very important that we're educated on what is the problem, what is the extent of the problem, how did we get here, and where do we go from here. And I would ask each and every one of you that are attending today to go out and share what you hear today as fact-based. We have a lot of information out in the public that isn't fact-based. And I would venture a guess that somebody you're going to come in contact with in the next 72 hours is plagued by this disease, either with their neighbor, their family, their mother, their father, their brother, their sister. This is physiologic. It is not something that anybody can just turn off. It is the way the brain is receiving messages. Once you become addicted to this, opioids are heroin. They're just in a pill form. But that is the truth. These are undisputed facts. 80% of the people that that go on to use heroin started on prescription opioids. So 80% of the people that are now addicted to heroin started with prescription opioids. They go to heroin because it is far cheaper than the opioids if they're cut off from a medical source and they go to the street. You can now buy a bag of heroin anywhere for $5 today. This is sobering. And I'm sorry, because usually when I come to talk, and especially to healthcare professionals, I love to be inspirational, to say that we really have so many positive things going on. But when I'm asked to talk about opioid and heroin, it's a sobering message, and I want everybody to understand how sobering it actually is. I think some of the things I talked about are hope. I think the vigilance in prevention. I think the really encouraging funding for this public health crisis. For the money we spent on Ebola, and how many people know how many Ebola cases we have in the United States? Like 2, and this is 10 people dying every day. So we're not even close in terms as of yet of the money we're spending on this drug crisis. So I guess I can't be a total Debbie Downer, so I'll say the message of hope is that if we work together and we work diligently, I believe we can prevent deaths, but we also have to prevent people from becoming addicted in the first place. So thank you very much for your kind attention.